Close your eyes for a moment and picture a single persistent itch, no bigger than a whisper on your skin, but impossible to ignore. Now, imagine that tiny irritation isn't just another annoyance, but your body's urgent SOS. For anyone over 60, a deep, unshakable itch in one pinpointed spot can be far more than dry skin. It could be cancer sending its first quiet alert. You might dismiss it as a fleeting tickle, yet that very itch could be the earliest clue to a hidden tumor growing silently beneath the surface. In the next few minutes, I'm going to guide you through 5 specific itches that demand your attention, locations on your own body where cancer often makes its first subtle appearance. Recognizing these signals early can buy you precious time, dramatically improving treatment success. Don't scroll past this video. Your life and the lives of those you love may depend on understanding these deadly quiet warnings. We often dismiss an itchy patch as nothing more than dry skin, a reaction to a new soap, or even an irritating shirt tag. Yet for adults over 60, certain itches that stubbornly persist for weeks and refuse to respond to every cream or lotion you try can be much more ominous. Underneath your skin, cancer cells can be quietly multiplying and releasing inflammatory chemicals into your bloodstream. These chemicals travel through your body and agitate nerve endings far below the surface, creating a deep, burning or crawling sensation where the skin otherwise looks completely normal. Unlike a simple case of dermatitis, these tumor-driven itches are relentless. They don't ease at night, they don't improve with hydration, and they often return in the exact same spot. Spotting these silent signals can give you a critical head start, catching cancer months before pain, lumps, or other dramatic symptoms appear. Early detection transforms the fight. Smaller tumors are easier to treat, therapies are less aggressive, and survival rates improve dramatically. In the next segment, we'll pinpoint the 5 most telling itches and explain exactly why each one matters. Remember, listening to these whispered warnings could save your life. Sign number 1. Lower legs, shins, and calves. When you think of cancer, an itch on your leg probably isn't the first symptom that comes to mind. Yet for seniors, a deep, burning itch along the shins and calves, one that feels like ants crawling under the skin or a slow, smoldering fire, can be your body's earliest red flag. Unlike an ordinary case of dry skin or a minor irritation from new socks, this kind of itch is relentless. It doesn't improve after a hot shower, it won't fade with every brand of lotion you try, and it often intensifies at night, keeping you tossing and turning when you should be resting. So what's happening beneath the surface? Many blood-related cancers, particularly lymphomas, such as Hodgkin's and non-Hodgkin's lymphoma, originate in your lymphatic system, a vast network of vessels and nodes that filters your blood, drains excess fluid, and supports your immune defenses. As malignant lymphoma cells multiply, they release a cascade of inflammatory proteins called cytokines into your bloodstream. These cytokines travel far and wide, and when they reach the nerves in your lower legs, they trigger persistent irritation and a burning sensation, even though the skin itself may look perfectly normal. Take George's story, for example. At 75, he was active, playing golf twice a week, tending his rose garden, and keeping up with his grandchildren. Then came that inexplicable itch on his shins. At first, he dismissed it as eczema or maybe a reaction to a new laundry detergent. He applied thick, medicated creams every evening without relief. 6 months went by, and the itch remained. Finally, during a routine checkup, George mentioned his nightly scratching to his physician. The doctor ordered a complete blood count and saw alarming elevations in white blood cells. Further scans revealed swollen lymph nodes in George's chest and abdomen. The diagnosis? Early-stage Hodgkin's lymphoma. That persistent leg itch had been ringing a silent alarm months before any other symptom appeared. Here's the critical lesson. Any lower leg itch that lingers for more than a few weeks, shows no accompanying rash or visible skin changes, and refuses to respond to moisturizers or topical treatments should raise a red flag, especially if you're also experiencing night sweats, unexplained fatigue, or unintentional weight loss. Don't wait for pain or lumps to develop. Mention the exact pattern, the location, how long it's lasted, and its response to treatments when you talk to your doctor. Ask specifically for blood work to check your white cell count and markers of inflammation. Early detection in lymphatic cancers dramatically improves treatment outcomes, often requiring less aggressive therapies and yielding higher remission rates. Remember, your body often whispers before it shouts. That persistent burning leg itch could be the earliest whisper of lymphoma. Take it seriously, get the tests you need, and give yourself the best chance for a positive outcome. Sign 2. Upper back, between shoulder blades. When you think of pancreatic cancer, images of weight loss, jaundice, and abdominal pain likely spring to mind, not an itch between your shoulder blades. Yet, for many older adults, that deep, phantom-like tickle right between the shoulder blades is one of the very first signs of trouble. Unlike the superficial itch caused by dry air or friction from clothing, this sensation feels as though it's originating from beneath the skin, as if something inside is lightly brushing against your nerves, and no coconut oil, back scratcher, or change of shirt will make it go away. Here's what's happening under the surface. The pancreas sits just behind the stomach and in front of your spine, connected to your liver by a slender channel called the bile duct. When a tumor begins to grow in or near the head of the pancreas, it can press against or obstruct that duct, preventing bile salts from properly draining into your intestines. Instead, those salts build up and leak into your bloodstream, circulating through your body until they reach nerve-dense regions, like the area between your shoulder blades. Once there, the excess bile salts irritate the nerves, creating a persistent internal itch that defies all topical remedies. Here's what's happening under the surface. The pancreas sits just behind the stomach and in front of your spine, connected to your liver by a slender channel called the bile duct. When a tumor begins to grow in or near the head of the pancreas, it can press against or obstruct that duct, preventing bile salts from properly draining into your intestines. Instead, those salts build up and leak into your bloodstream, circulating through your body until they reach nerve-dense regions, like the area between your shoulder blades. Once there, the excess bile salts irritate the nerves, creating a persistent internal itch that defies all topical remedies. Consider Linda's experience. At age 70, she was active and well, walking her dog each morning, attending her bridge club, and tending her rose bushes. But she began to wake each night scratched raw between her shoulder blades. She tried soothing gels, swapped out her laundry soap, even experimented with different pillows, but nothing helped. When Linda mentioned her nagging back itch during a routine check for fatigue, her physician ordered liver function tests, which revealed elevated levels of liver enzymes. Concerned, her doctor followed up with an abdominal ultrasound and eventually an MRI. The culprit was a small pancreatic tumor that had not yet caused pain or weight loss. Because Linda caught it early, thanks to that unexplained back itch, her medical team was able to remove the tumor before it spread, dramatically improving her prognosis. The key lesson here is simple. Any persistent upper back itch without an obvious skin-related cause, and especially if you notice accompanying signs such as pale stools, dark urine, or unexplained fatigue, should prompt further evaluation. When you speak with your doctor, describe exactly where the itch occurs, how long it's lasted, and what you've already tried to alleviate it. Request liver enzyme tests and imaging studies, such as an ultrasound or MRI of the abdomen, to check for blockages in the bile duct or early masses in the pancreas. Remember, pancreatic cancer is notoriously difficult to detect in its early stages, because it often doesn't produce pain until it's advanced. That phantom itch between your shoulder blades may be the body's way of whispering a warning before more serious symptoms emerge. By paying attention and acting promptly, you can gain a valuable time advantage in diagnosing and treating pancreatic issues, time that for many can make all the difference. Sign 3. Scalp without dandruff. When most of us experience an itchy scalp, we assume it's a simple case of dandruff, dry skin, or an irritant in our shampoo. We scrub until our scalp tingles, slather on anti-dandruff formulas, and wait for relief. But for seniors, a persistent, wandering itch on the scalp, one that feels like tiny pins and needles, a slow-burning crawl, or an electric zap, can be much more concerning. This isn't the flaky white dust that flutters from your shoulders. It's a deep, nerve-driven sensation that moves from one patch of skin to another and refuses to respond to any over-the-counter remedy. So why does this happen? Certain blood cancers, like chronic lymphocytic leukemia, CLL, produce abnormal white blood cells that circulate through the body and disrupt the normal regulation of inflammation. These malignant cells release signaling molecules that can sensitize nerve endings under the scalp, creating a tingling or burning feeling even when the skin itself appears healthy. Additionally, skin cancers such as basal cell carcinoma or squamous cell carcinoma can develop on thinning hair areas and irritate local nerves, triggering similar sensations. The key difference is that cancer-related scalp itch doesn't accompany visible flakes, redness, or crusting. It's purely a nerve response to internal pathology. Consider Henry's experience. At 73, he maintained a rigorous daily routine: morning walks in the park, weekly bridge games with friends, and afternoon tea rituals. Then came the itch, first faint, then relentless, around his crown and temples. He swapped shampoos, switched to scalp oils, even removed his favorite baseball cap, but nothing offered lasting relief. Every afternoon, the sensation returned, a creeping electric buzz under his hair. Growing concerned, Henry mentioned it during a physical exam. His physician ordered a complete blood count, which revealed elevated lymphocyte levels. A subsequent bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. That maddening scalp itch had been the first signal. The lesson here is vital. If you're over 60 and your scalp itches persistently, especially in patches without flakes or redness, and if you also feel unusually fatigued, bruise easily, or experience unexplained weight changes, push for a full blood panel. Ask your doctor to check white blood cell differentials, platelet counts, and markers of inflammation. Simultaneously, schedule a dermatologist exam. Under bright clinical light, subtle skin cancers or precancerous lesions become visible, allowing for early intervention. Don't dismiss that crawling, burning, or tingling scalp sensation as an inevitable part of aging. It may be your body's way of whispering a warning. Early detection of blood and skin cancers significantly increases treatment options, reduces the need for aggressive therapy, and improves overall prognosis. By listening to these nerve-driven itch signals, then acting swiftly, you give yourself the best chance to address hidden malignancies before they progress. Remember, your scalp doesn't lie. When it speaks through an unshakable itch, it's time to listen and investigate.
Sign 4. Chest or breast area. When a stubborn itch takes up residence on your chest or around your breast area, it's easy to blame a snug bra, a friction spot, or simple age-related skin thinning. Yet for seniors, both women and men, this localized, unshakable itch can be a critical early warning sign of something far more serious than just irritated skin. Unlike a fleeting chafe or a mild rash, this itch often feels deeper. A lingering tightness, an almost electric tingle, or a rough sandpapery texture beneath the skin. You might even notice that the area feels warmer or slightly swollen, yet there's no obvious rash or lesion to explain it. Why it happens? Inflammatory breast cancer, IBC, is notorious for its silent aggression. Rather than forming a neatly defined lump, IBC cells invade the lymphatic vessels in the skin of the breast, causing fluid retention, redness, and that distinctive itching or tightness. Because the underlying tumor spreads diffusely, you won't always feel a solid mass, but the skin itself cries out through nerve irritation. Even non-breast tumors that lie close to the chest wall can inflame dermal nerves in the same way. On the underarm side, enlarged lymph nodes, whether due to lymphoma, metastatic spread, or infection, can further exacerbate the itch by pressing on adjacent nerves. Real-life story. Ruth, a lively 69-year-old grandmother, noticed a persistent itch right beneath her right breast. She swapped out her bras for softer fabrics, scoured for new hypoallergenic detergents, and even experimented with going braless. But the itching never relented. It felt as though the skin tissue itself had become tight and slightly rough, even though nothing appeared red or scaly to the eye. Finally, she mentioned it to her physician, who carefully examined her chest. Under close inspection, the doctor noted subtle skin dimpling, like the texture of an orange peel, around the nipple. Ordered imaging revealed an aggressive tumor infiltrating the breast tissue. Because Ruth acted on a seemingly minor itch, her medical team could initiate treatment while the disease was still confined, significantly improving her outlook. Key takeaway: never brush off a single spot itch on the chest or breast area that doesn't respond to moisturizers or lifestyle changes. Pay attention to accompanying clues: unusual warmth, slight swelling, skin texture changes, or underarm fullness. When you bring this to your doctor's attention, describe exactly where the itch is located, how long it's persisted, and what you've already tried. Request a thorough clinical breast exam. Insist on diagnostic imaging, such as a mammogram or breast ultrasound, and, if indicated, an MRI. Early detection of inflammatory breast cancer or any nearby malignancy hinges on noticing and investigating these subtle but significant symptoms. Your body may be whispering a warning. Don't wait for it to scream. Sign 5. Anal and genital region. A raw, burning itch down there can be far more than an embarrassing annoyance. It may be your body's urgent plea for help. Unlike the fleeting irritation from chafing or surface yeast infections, this itch persists relentlessly for weeks or even months. It may feel like your skin is raw, as though a small fire is smoldering beneath the surface, and no amount of extra hygiene, barrier creams, or dietary tweaks seems to help. If you're over 60 and dealing with an itch in the anal or genital area that refuses to relent, it's time to pay attention. Why it happens? In its earliest stages, anal, vulvar, or penile cancer can present with nothing more than a stubborn itch. Cancerous lesions or precancerous growths on the mucosal surfaces irritate nearby nerve endings, producing that raw, burning sensation. Similarly, inflamed lymph nodes in the groin, whether from lymphoma, metastatic skin cancers, or local infections, can press against nerves and cause chronic itching. Because these lesions are often small or hidden, the itch becomes the only visible signal of deeper pathology. Real-life story. Eugene, a 76-year-old retired teacher, battled a nagging anal itch for nearly a year. Convinced it was just hemorrhoids, he tried over-the-counter suppositories, SATS baths, and a high-fiber diet. Nothing worked. The itch returned each night, leaving him frustrated and reluctant to seek further help. Finally, after his daughter insisted he see a specialist, Eugene underwent a colorectal scope. To his surprise, the doctor discovered a small tumor on the anal canal wall. Because it was caught early, triggered only by the persistent itch, Eugene's medical team was able to remove the lesion and begin targeted therapy before it could spread. For older women, a similar story often unfolds with vulvar cancer. A 68-year-old grandmother might assume her itching is purely due to postmenopausal dryness or irritation from incontinence pads. Yet when that itch flares relentlessly in one spot, particularly if accompanied by subtle skin discoloration or a small rough patch, it may signal early vulvar carcinoma. These cancers thrive in areas rich with nerve endings, but can remain virtually invisible without a focused exam. Key takeaway: don't let embarrassment or assumptions delay you. If an itch in the anal or genital region endures for more than a few weeks and does not respond to hygiene adjustments, barrier creams, or dietary changes, seek a specialist's evaluation immediately. Describe precisely where the itch is located, note if it worsens at night, and mention any accompanying sensations: burning, rawness, or tightness. Request a colorectal or gynecological exam under proper lighting, and, if needed, insist on a biopsy of any suspicious area. Early detection of these hidden cancers dramatically increases treatment success and can spare you more invasive procedures down the road. Your body is whispering, don't wait for it to shout.
Clear takeaway and lesson. When your body repeats the same itch in the exact same spot, it's trying to tell you something important. These 5 zones, the shins and calves, the space between your shoulder blades, the scalp, the chest or breast area, and the anal or genital region, aren't random itch locations. They're favored routes for certain cancers to send their first quiet signals. You don't need to panic, you need to pay attention. Note the precise pattern, where the itch occurs, how long it's lasted, and what treatments you've tried. Share this information with your doctor. Ask for targeted blood tests for inflammatory markers or white cell abnormalities. Request liver panels or imaging if the upper back is affected. And pursue dermatologic or colorectal evaluations when appropriate. Early detection starts with curiosity and action, not fear. By speaking up about a stubborn itch, you give yourself and your care team the chance to catch potential cancers months sooner, when treatments are most effective. Don't ignore that whisper. Investigate it. If any of these warning signs spoke to you, drop the corresponding sign number in the comments below so I know you're paying attention and so we can support each other in staying vigilant. Don't forget to hit that subscribe button and ring the notification bell to receive more life-saving senior health tips straight to your feed. Share this video with family or friends who might benefit. Your awareness could be exactly what helps them catch an issue early. Remember, a simple comment or click can empower someone to act. Stay curious, stay proactive, and let's make every whisper from our bodies count.